Hey y'all, Eric here. It's been a minute since I've done a video, so I thought I'd jump on here because I intended to do a few videos yesterday, but I just got caught up in some other things. But first, let me just acknowledge Happy Pride, and particularly LGBTQ Pride. Happy Pride. And this shirt is from when I lived in Kansas City. I was a member of One Life Fitness. So I can't remember what year it was, but this was their tank top during Pride. And actually, it was created as a fundraiser for the loss of lives at Pulse Club down in Florida. So I wear this with pride. So let's talk about North Carolina Senator Tom Tillis. Unless you've been in Iraq or really not looking at the news, there have been commercials on Paramount Plus and Amazon Prime and on YouTube about him saying now he's a clean energy person, and also now he is saying that there should be Medicare cuts. Yes, he said there should be Medicare cuts, which is connected to the big beautiful bill. Anyway, for transparency in my background, I used to be a licensed Medicare insurance person, so I know about Medicare. I'm not licensed anymore because that was about 30 years ago. But let's just dive into this. So, first, do I support Tom Tillis? No. Absolutely no. He needs to go away. He has to be reelected in 2026, the midterms. And so some of his ads are white lies, saying that he thanked Senator Tillis for clean energy. The clean energy that he's supporting is nuclear energy, not wind power, not solar power, not water power, but nuclear power. Now, nuclear power has some things, because also in the news last week, Meta, which is the owner of Facebook and Instagram, Mark Zuckerberg, saying that Meta bought, I can't remember the amount, but it was in the millions, of nuclear power for AI. For AI storage. Yes. That was kind of like under the radar. But again, these ads are being done by, let me see, the AFP. The AFP and another group, which is based in Charlotte, about Senator Tillis, and they are conservative groups. So first of all, let's talk about what he's saying about Medicare Advantage and about waste, fraud, and efficiency. That is code to get rid of benefits. It is. Because all the Republicans said they were never going to cut benefits. And now, the big beautiful bill, in order to pay for the 2017 tax cuts, and let me pause right there, because there's another ad from the AFP who spent $4 million on ads to buy support support from us, citizens, for Trump's tax cuts in the United States Senate, because there's a possibility that the Senate will not pass that bill. But again, the 2017 tax cuts, saying that all this money went to families' pockets. One of the commercials was about a mother who was a teacher and yada, 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 and Trump's tax cuts saved their budgets. Lies. Trump's tax cuts went directly to the 1%. If you are not a millionaire or a billionaire, there was nothing that got into your pocket. No. Do I have the receipts? Sure. But let's go back to Medicare cuts. What he is talking about is Medicare Advantage. Medicare Advantage is sold by insurance companies. And for the most part, you would understand Medicare Advantage as Part C. It's kind of like an all-inclusive plan, including Part A, Part B, and Part D, hospital insurance, doctor's insurance, and then prescription insurance, which are separate. And Part B has a premium that you have to pay each month. If you enroll into Medicare Advantage, then you have everything all included, plus possibly hearing, vision, and some other benefits that Part A does not have, Part B by itself does not have, and Part D by itself does not have. And depending on where you live, there is a possibility that there is no premium, no monthly premium for your Medicare Advantage plan. Now, Senator Tillis is saying that there is waste, fraud, and abuse under Medicare. And he's talking about the Centers for Medicare and Medicaid, but he's focusing on Medicare, and in Medicare, he's focusing on Medicare Advantage. So, let's talk about Medicare fraud. Let's do that. Actually, I'm going to show you some of my receipts. So let's dive in. So here, let me bring this over. There we go. So here is an overview of his key points on his stance, proposing Medicare changes as part of Trump's legislative package. Tillis supports proposals for Medicare changes, which are part of a larger package including Medicaid reductions. See, that's the first lie, because all the Republicans said that they would never cut benefits, particularly with Medicaid, and that's not what this video is about. But for context, in the big beautiful bill, Medicaid cuts to the tune of $880 million. Excuse me, I believe it's $1 billion. $880 billion of cuts. Which means, based on that number, there is a possibility that more than 11 million people across the country would lose their insurance. Would lose their insurance. I'll repeat that, and I'm going to give you context. More than 11 million people across the country will lose their insurance. And here's the context. Do you remember former Alaska Governor Sarah Palin? Sarah Palin said that Obamacare, if it had passed, would create death panels. That's what she said. it would create death panels. $11 million people losing their insurance will create panels, excuse me. And how do I know that? And how would you know that? Senator Joni, what's her name? I don't even remember the Ernst, Senator Joni Ernst. She's from the state of Iowa. She did a town hall, and people were upset about health insurance cuts. And these were the words that came out of her mouth. There are videos about this, that people said if these healthcare cuts go through, people will die. She said, well, we're all going to die. And I said that to my housemate, and this was his facial expression. And I said, yes. A U.S. senator opened her mouth and said that to her constituents. Well, then she tried to backtrack and did a Instagram or a TikTok video that was supposed to be an apology, that she did not mean that it was okay for people to die, that she did not want anybody to die. She wants everybody to live. And that would have been fine until the end of the video, where she said, if you want everlasting life, please follow my Savior, Jesus Christ, for everlasting life. Which was a dig to the people who are going to die, and if they were not Christian, they would not have everlasting life. A U.S. senator said this. And if money matters to you, a U.S. senator makes $174,000 a year. I don't know about you, but my early retirement, my Social Security benefits don't even get close to that. My housemate has a full-time job. It's been his job for a long time. Do you think he's making $100,000? No. How many? I only know one person that's making more than $100,000 a year in his job, and he's been doing this job since his 20s. Yes, I know one person who's making that much. My own brother doesn't make that much. He's close to it. He works for the VA. He's close to it. But no, not even he. Former military, works for the VA, doesn't make that much money. And yet, this person who was voted into office, which said something about the people of Iowa, yes, I'm calling you out. It says something about the people of Iowa who put this person into that one of their 2 senator seats to go to Washington, who said, well, we're all going to die at some point. I'm not at the end of the video, but I'll just go ahead and say this. Elections have consequences. They do. Elections have consequences. But I digress. Let's go back to our topic about Medicare fraud. So there's an article from the Wall Street Journal that talked about Medicare fraud. And they're talking about Medicare Advantage and all of that. So we'll just go through this article, not the whole article. I'm going to link it in the description of the video. In fact, I'm going to link everything in the description of this video so that you can see that. And I need to stay on topic because we're at 15 minutes right now. So let's dive in. So again, it's the Wall Street Journal. Insurers pocketed $50 billion from Medicare for diseases no doctor treated. I'll give you a minute to read it again. Insurers, which means the insurance companies, pocketed $50 billion with a B, from Medicare for diseases no doctor treated. Questionable diagnosis of HIV and other maladies triggered extra Medicare Advantage payments. It's automatically impossible. So, this article was updated on July 8th, 2024. And so this is current. So Gloria Lee was perplexed when the phone call started coming in from a representative of her Medicare insurer. Could a nurse stop by her Boston home to give her a quick checkup? It was a helpful perk, no cost. In fact, she'd get a $50 gift card. After several such calls in 2022, Lee agreed. A nurse showed up, checked her over, asked her questions, then diagnosed her with diabetic cataracts. The finding was good news for Lee's insurer, a unit of United Health Group, who has been in the news for bad things and then a worse thing that happened, a murder of the CEO. Medicare pays insurers more for sicker patients. In the case of someone like Lee with diabetic cataracts, up to about $2,700 more a year at that time. But the retired accountant doesn't have diabetes. Her own doctor later said, let alone the cloudy vision sometimes caused by the disease. Context, just to let you know, remind you, I talk about this on some of my videos. On April 21st, I was diagnosed by my primary care physician based on my blood test that I am type 2 diabetic. You see, I wear glasses. I started wearing glasses in my 40s, but I just got typed almost 2 months ago. And we are watching. My last appointment was this last Thursday, and the doctor is asking me to reach out to where I got my glasses from and my eye exam to send them records to see if they'd done something about verifying that I do not have diabetes, a diabetic vision issue. Because when you're diabetic, it can affect your vision. It can affect your nerve endings. The older you are with diabetes, and you don't take care of yourself, particularly your feet, you lose the feeling in your nerves. In fact, I had a diabetic foot test yesterday, and I passed. The people get ulcers and all this other kind of stuff in their feet, and they never knew that something happened until they would see blood or pus or something, or see the discoloring in their feet, which means if you see discoloring in your feet, it's time to see somebody. It's way past seeing somebody. So anyway, back to the story. Private insurers involved in the government's Medicare Advantage program made hundreds of thousands of questionable diagnoses that triggered extra taxpayer-funded payments from 2018 to 2021, well into the COVID pandemic, including outright wrong ones like Lee's, a Wall Street Journal analysis of billions of Medicare records found. From 2018 to 2021, hundreds of thousands of questionable diagnoses that triggered extra taxpayer-funded payments after the Wall Street Journal analysis of billions of Medicare records. Now, if that's true, by simple definition, that's fraud, defrauding the government. But here's my point. That defrauding came from the insurance companies, not from the Center for Medicare. It came from the insurance companies, not from the center that makes the payments. Now, should someone at the center of Medicare, in the payment system, going through the paperwork, things get missed. They do. Things get missed. But these overpayments, the focus on overpayments has been on Social Security, that people were being overpaid and then they have to pay that money back. But that's not what I'm talking about. We're talking about Medicare. I will agree that there is fraud. There is fraud. But the fraud doesn't come from Medicare. It comes from the insurance companies defrauding the government to get paid for diagnoses that were not true. But again, let's continue. Medicare Advantage, the $450 billion a year system in which private insurers oversee Medicare benefits, grew out of the idea that the private sector could provide health care more economically. It has swelled over the last 2 decades to cover more than half of the 67 million seniors and disabled people on Medicare. And again, as I said earlier, as a former insurance agent for Medicare, I mean, you can't really sneeze at an insurance plan that is an all-inclusive plan that has extra benefits with the potential of not having a monthly premium. Over half of the 67 million people who are enrolled in Medicaid have some type of Medicare Advantage plan. Instead of saving taxpayers money, Medicare Advantage has added tens of billions of dollars in costs. Researchers and some government officials have said one reason is that insurers can add diagnoses to ones that patients' own doctors submitted. Medicare gave insurers that option so they could catch conditions that doctors neglected to record. The journal's analysis, however, found many diagnoses were added for which patients received no treatment or that contradicted their doctor's views. Yes. Insurers added diabetic cataract diagnosis to many patients treated by Goodyear, Arizona ophthalmologist Dr. Howard Chen. And this is his picture. And again, maybe some of these diagnoses were true, but some of them were not. And if they were not true, again, sounds like fraud to me. And so the doctor got paid, and the insurance company got paid. And where did that money come from? The government. So like I was saying, I agree that somebody at the center of Medicare, some oversight group or efficiency liaison, someone could have audited the books. Surely they have an audit yearly. But it's the government. And so, I'll use my own state as the example. I'm a commissioned notary and have been for about half a year, 6 months so far. And even just the notary division in the North Carolina state government is inefficient. They are understaffed. There are questions that we as notaries need to ask from the experts, and they won't pick up the phone. We are waiting on, I won't say it's as bad as the DMV, but every state has DMV issues. But if we really want to talk about government waste and fraud, let's put the spotlight on the actual fraud. And the actual fraud is not from a government agency. The fraud is from the insurance agencies. They are stealing money from the American people and yet denying, because I'm about to get in the battle myself, because right before I lost my job, when I was living in Kansas City, I was working for Amazon as an HR professional. And there was an ice storm in January. And I got off the bus, changing buses to get on another bus to actually get to my building. The bus stopped, and when I got off the bus, I stepped on a sheet of ice and I fell. The city did not treat the roads. They didn't treat the sidewalks downtown either. This was early in the morning too. And I fell. I thought my backpack had broken my fall, and I was actually scared that I may have broken my work laptop. But hell, they can give me another one. But then I pulled myself up. It took me a couple of minutes to get my footing to use the bus door to pull myself to stand up because the ice was that bad. But I was able to make it across the street and got some traction and got up to the other side of the hotel to wait on my next bus to get me to work. So fast forward, a few days later, my lower back started hurting, and there were some days where I just couldn't stand up. So I took some time off. My back muscle started spasming. So I took an Uber to the emergency room, which is an ordeal in itself. These people could clearly see me trying to sit down in my chair, and my back was spasm. Or they tried to help me stand up to get me into a wheelchair to take me into the room to be examined, and my back was spasming. So finally I got into bed, and then the doctor came in and examined me, and it was excruciating pain when he just simply touched my lower back. So long story short, I lost some cartilage. It was my tailbone, and they gave me some medication and then sent me on my way. And so all of that happened, and then fast forward, that was at the end of January. Fast forward 2 weeks later, I lost my job at Amazon. And so I had insurance on the day of the accident. I had insurance when I went to the emergency room, and when I went back to work, I still had insurance. I think about 6 months, it had gotten into the summer, and I still hadn't found another job. I was getting EBT benefits, but my unemployment was denied. But then right around, I would say July or August of that same year, I started getting letters from the hospital saying that I owed them $11,000, that my insurance company had denied my billing, because I got a statement of benefits that showed that I wasn't going to have to pay anything, not even my deductible. And so I was scratching my head, and so I've been dealing with this for over a year. And of course, the insurance company saying that I didn't have insurance at the time. And I've sent them document after document showing them that I was employed and had insurance for a number of days after I lost my job, and so that bill should have been paid by the insurance company. But a collections agency is trying to come after me for the $11,000, and that ain't happening. So my point is, even using me as an example, is that you have insurance companies on the one hand defrauding the government, because they're getting money from the Center of Medicare that they should not be getting. And then number two, denying coverage that people have been paying for. And these issues, like my back, these issues were covered, but not processing them until after the fact. Oh, well, Mr. Norman doesn't have insurance, so denied. Instead of looking at the dates on the billing, and then even trying to talk to my company, my former company, say, when was this person employed, to verify that I actually had insurance at the time. No, the onus is on me now to prove that I was employed at that time and that this bill should have been paid by them. So I probably am going to have to sue that insurance company to get them to pay this bill. Because I can tell you, I don't have $11,000 sitting somewhere. That was a bill for me being in the emergency room for 6 hours. So, yes, there is waste, there is abuse, and there is fraud, but it's not in the government. Well, there's waste, and I would go so far as to say abuse in the government. But this particular fraud has nothing to do with Medicare itself. It has to do with the insurance companies and then the failings of whoever is auditing or doing the audits for the Center for Medicare. Context for that. The Pentagon has failed their yearly audit every year for the last 10 years. And you want to talk about waste? Yet they keep giving them more money. Keep giving them more money, but they can't stay on budget. They can't stay on budget. Well, it's no wonder, because the current commander-in-chief wants to add $2.4 trillion to the national debt, which is also part of this big, beautiful bill. But I'm actually getting off point. And so I would say that this is just receipts that Tom Tillis and whoever is doing the research for Tom Tillis need to have their hands slapped because their focus is in the wrong place. Their information is coming from the wrong spot. They don't have the whole picture. Do you know how long it took me to find all of this? I just simply typed in a search engine. The Wall Street Journal information came up. Tom Tillis' talking points about clean energy came up. Tom Tillis' talking points about Medicare Advantage came up. And I knew that there was another article that had that same dollar number of $50 billion in fraud in the year 2022 or 2023 due to the same thing. Insurance companies and providers. And I remember it being on the news. There were providers like doctors, healthcare providers in the state of Florida who were arrested. They were caught doing this very thing, fraud. So I would say, Senator Tillis, if you're watching this video, you're doing it wrong. And you've been doing it wrong for a long time just to curry favor with the sitting president, and because you know that you're up for re-election in 2026. And you've also been primaried. The guy who's running against him, I don't believe that he has a chance in beating Tom Tillis. But as long as it causes him to spend money that he has, I think it's about $7 million he has in his war chest, that's fine. But of course, all of us in North Carolina are hoping that former Governor Roy Cooper will become the Democratic nominee to run against Tom Tillis, and he can beat him. He can beat him. So Tom Tillis, you are on notice. You're done. You're done. Time to move on. Time to move on and let somebody else in there who actually can find the actual abuse. But the other thing, too, that I think for those of you who are viewing this video should know, when someone puts their hat in the ring to run for office, check to see where they're getting their donations from. And then match that to their talking points. I think you'll find that interesting that when I lived in Missouri, we then did that with Senator Josh Hawley. Josh Hawley was railing against insurance companies and beating his chest about fraud, waste, and abuse, yet a lot of his money comes from, guess what? Insurance companies. That industry helped fund his re-election. So they wouldn't just throw money after somebody. They threw their money behind somebody who was in their best interests. This is not rocket science, people. It's not. It happens every single day. Every single day. And like I said, when I was watching some show and I kept seeing these commercials about the tax cuts, this is what I'm talking about. The AFP, the Americans for Prosperity, announced a new $4 million ad to bolster support for the passage of the Republicans' tax bill in the U.S. Senate because they're scared. They're scared. They know that there's a real possibility that this bill is going to fail in the Senate, which means it doesn't go forward. The ad comes as opposition groups began launching efforts to mislead what they're saying, mislead Americans about the contents of the legislation and its impact. The new buy, announced for the month of June, features video and digital ads that will air on cable, connected TV, and other digital platforms. This is a small business owner right here who says out of her mouth that if it were not that the 2017 tax cuts kept money in small businesses. I can't tell you how many businesses that I knew of in the state of Missouri who closed because they could not support themselves because money was not coming in. There was no help. And I've seen 3 videos, one from Melody, one from Nancy, and one from Andrea. I haven't seen, actually, yes, I've seen the one from Seth. In fact, here it is. One testimonial features Melody, a working mom and small business owner who says, President Trump's tax cuts have put thousands of dollars back into my family's pocket and helped me grow my business and invest in my employees. Really? Because what I was waiting on was for Kamala Harris to become president, who would allow someone like me, who has a small business that I launched this year, that I'm trying to get up and running, but a lot of the equipment that I need is expensive. And my poultry, which I'm very appreciative of, but my poultry Social Security benefit that comes every month ain't enough. Which is one reason why I created my small business. And so I would have been able to get loans or grants to buy this equipment and then write that off at the next year, because everybody knows the $5,000 amount that you can get in tax benefits for having an LLC is not nearly enough. to cover expenses for starting a business. Did I see any of that money? Because the 2017 tax cuts are still in effect. They're still in effect. Do I, as a small business owner, see any of that money? Absolutely not. So I don't know where Melody got her money from, but I can assure her that there are more people like me who have small businesses who never saw any of that money, if it even existed. And so I think there are some half-truths in those ads that you see. But also, just so you know, that if he wants, I could actually help Senator Tillis out, because I also did another simple Google search, and I don't think I have to search it anymore because I think I actually saved it. I did. I'll show it to you. I simply typed in $50 billion in Medicare fraud. That's all I typed in. Took me 3 seconds to type that in. And then there's the Wall Street Journal article I saw that I read to you. And then there are others. There are others that say that. But then just the general overview right here. Recent news reports suggest that private insurers participating in the Medicare Advantage program were paid $50 billion in extra taxpayer funds between 2018 and 2021 based on questionable diagnoses, yada, yada, yada. Is there fraud out there? Absolutely. Here in Charlotte, North Carolina, we have a sitting city council person who, not for the first time, but the second time now, has been indicted on misappropriated funds, PPP funds, during COVID that were not used for her business, and she has been indicted, along with 2 of her children have been indicted for fraud. And when asked if she did this, her only answer was, I paid it back. That's her only answer. Now, I might extend her some grace if this was the first time, but it's not. So this is the second time she's been accused of fraud. And then right after she was elected to her seat, it was found that she was driving on a suspended license. She is an elected official driving knowingly driving on a suspended license. She was arrested for that. And so then she said it would not stop her from fulfilling her duties, that she would be taking public transportation to get to her council meetings. And yet her constituents in her district, nobody is asking her about this. Nobody. Well, I don't live in her district, but even if I did, she wouldn't be getting any grace from me. And I can assure you, had I been a constituent, I'd have showed up at that town hall and asked her pointedly about this situation. She's saying that it's politically driven. Where are the receipts? If you believe it's politically driven, name names. Bring it to light. You know, a city council person who's embattled. The sheriff is constantly embattled. The police chief is embattled. There's even talk about the entire city council being caught up in some kind of mischief and fraud connected to the police chief being embattled. This is ridiculous. These are elected officials and nobody's holding their feet to the fire. Tom Tillis, you are on notice. Tawana Brown, you are on notice. Charlotte City Council, you better straighten up. And now the school board, CMS, Charlotte Mecklenburg Schools, have let go 2 sitting principal and assistant principal people without even telling the parents why. They found out about each one of them 1 week after they were suspended. with pay, but are still not telling them why. Then I'm a member of the Carolinas LGBT Chamber of Commerce. There was an expo at the Vapor Center, which is actually in another city council person's district. She is actually a small business owner and a member of the chamber as well, who was talking about that. And she was on the news mad that somebody during their closed door meetings had leaked out information from that closed door meeting. Now, it's written in city council governments on all levels that they can have closed door meetings where there is no discussion from constituents, no speakers, nothing like that. It is just the conversation between council members. They can even do votes behind closed doors, and supposedly we just have to be good with the fact that they did that, and they might tell us and they might not, but then there are non-disclosure things. And so this particular city council person was upset that somebody leaked information out from this meeting scenario. I'm about to say it out loud, but I caught myself saying WTF. WTF. Why are we dealing with crap like this in the 25th century? Distraction. These are nothing more than stupid distractions when they're trying to pass a $3.6 billion budget for the city of Charlotte. We've even got the county commissioners embroiled in things. It's ridiculous. But now I'm off topic. But I just wanted to put this out there so that y'all would understand just how easy it is to find receipts to go against what these Republican people are saying. Now, I'm focusing on Senator Tom Tillis. There are viable candidates on the Democratic side that can beat him if they would just choose to run. And time is short. We're already in the election cycle. Time is short. And then Ted Budd, who's the other North Carolina senator, he's up for re-election during the next presidential cycle in 2028. And I can assure you, he's no better. Now, before I end this video, one other piece of information that I missed, honestly didn't even think about it, because we all know that on May 31st, Elon Musk is no longer a special governmental employee, nor is he head of Doge anymore. I think some people just assumed that once he left, that Doge would be no more. No such animal. Doge is still in full effect and has a new leader, and I'm going to show you who this new leader is, and we will talk about that just for a minute. His name is Russell Vought. I believe it's pronounced Vogt or Vought, like thought, Vought, Vougth. This message comes from Democracy Docket. I follow them on YouTube. And they actually do the due diligence. Democracy Docket is led by a former federal prosecutor who has tried cases against the Trump administration, who has tried cases in federal court. And they know all of this. And they have also been on top of Project 2025. Of course, everybody knows President Trump says that he knows nothing about Project 2025. Of course, we know that's a lie. But I bring that up because of Russell Vought's connection to Project 2025. So here is a picture of him. This is Russell Vought. I do apologize for mispronouncing his name. He currently, before being elevated, was Trump's budget hawk and one of the chief architects of the Heritage Foundation's Project 2025. Yes. One of the chief architects of the Heritage Foundation's 2025. Now, pay attention. With Vought, a self-described Christian nationalist, that's code for white supremacists, at the helm, the slash and burn effort against the federal government may be on the cusp of an even darker turn. In many ways, he is what Musk is not. After working at public policy organizations for the last 2 decades, he has a far better understanding of how the government works and how its weaknesses can be exploited. Despite advising Trump for almost 10 years, he's also kept a fairly low profile, rarely giving interviews or speaking in public. And he appears to be motivated first and foremost by creating a Christian nation controlled by an overtly Christian government. Just a little side note here to let you know, while we taught about this being the greatest democracy on the planet, what this country is not is a theocracy. We are not and never have been a theocracy. We are a constitutional republic. You can look across this planet to see governments that are run by religions, and you can see the state of those. Are these free-thinking nations? No, they are not. And as long as I have breath in me, this country will never become a theocracy. And before you keep start talking about me being anti-Christian and all this, that, and the other, my faith is stronger than probably most people on this platform. I can assure you of that. I just know when to call a spade a spade. But I digress. Last year, Volt told undercover journalist with the Center of Climate Reporting that he wants to, quote, to make sure that we can say we are a Christian nation. And my viewpoint is mostly that I would probably be Christian nation-ism. That's pretty close to Christian nationalism because I also believe in nationalism. Again, Christian nationalism is code for white supremacy. Other people have done videos about this. I would suggest that you search Brian Tyler Cohen, Democracy Docket. Brian's YouTube channel is called No Lie. Luke Beasley, The Bulwark, B-U-L-W-A-R-K, The Bulwark. Adam Paris, I believe his name is, P-A-R-R-A-S. Multiple people out there have done. There's another guy who's Reese Waters. Reese Waters has a channel called, well, he actually has several channels, but particularly his channel, just look up Reese Waters, and he has a channel called Troubled Waters. He will say, my name is Reese Waters, and I am troubled. And I said, see what he did there? Troubled Waters. He even talks about this. Another guy I follow, Coach D, out of California. He talks about this. Tabitha Speaks. She talks about this. There's a channel called I Have Had It. IHHI. They've been interviewed on The View, these two women. They have their number too. So any of those, you can view that. Now, going back, to achieve this, he said in the interview he seeks to replace the nonpartisan and merit-based federal civil service with a bureaucracy in which employment hinges on allegiance to Trump. See that? Allegiance to Trump, meaning bend the knee and kiss the ring. This country is a constitutional republic. It is not a kingdom, and Trump is no king. He is no king. Back on Flag Day, which is June 14th, and I'll point to my flag right there. That's the LGBT flag because it's Pride Month. Happy Pride. I have no king. No, I have no earthly king. He is President of the United States. He's Commander-in-Chief of our armed forces. He was elected to do so. I didn't vote for him. But he is no king. He is no king, and I will not bend the knee to him. I will not. But, again, this guy who is now running Doge is essentially saying your employment in the federal government will be connected to whether you salute and show 100% allegiance to Donald Trump. Otherwise, you lose your job or you don't get the job. He also seeks to impound congressionally approved funding, help coordinate massive deportations, and find ways to let Trump use the military to put down protesters. Does martial law ring a bell? Does that ring a bell? Does fascism ring a bell? That's essentially what fascism is. But like I said, I'll link this in the video. It actually has gone longer than I thought it would. But this is important. This is stuff that matters. Stuff that matters. You know, I'll be Medicare eligible in 3 years. My housemate will be Medicare eligible in 5 years. My brother will be Medicare eligible in a few days because he's 2 years older than me. My housemate's sister, their mother, is already in Medicare. This affects all of us. And I'll remind people that if this bill passes and Donald Trump signs it, more than 11 million people will lose their insurance. And I just might be one of them because I'm on the state Medicaid rolls. Because I'm retired, my only income is Social Security, and I didn't make enough money to I don't have enough income coming in to qualify for the ACA. Ironically, the ACA was created for people like me, but there is a monetary threshold that you have to meet to be eligible for it, and they automatically referred me to my state's Medicaid department, and they automatically enrolled me Medicaid, which is why I have insurance now and was able to get my glasses, able to get a PCP, make sure that everything is going on, because if I didn't do it, I would never have known that I have diabetes, and it could have killed me. I mean, it still might, but I'm doing the work. So, and I wouldn't be able to afford the prescriptions either, because I am on insulin. I am. And Ozempic and a couple of other things. But hopefully soon I will be off the insulin if everything goes well. If my A1C number is where it's supposed to be in July, I will probably be off the insulin. Yep. But that's all for this video. I actually was going to do 3 different videos, but I got everything I wanted to say in this video. And if you made it this far, thank you. I appreciate you sticking with me. I know I was going all over the place a little bit, but this matters. If you're young enough that you don't think this matters to you, there is someone in your life who is affected by this. It is, and it matters. It matters. And even if you agree with Senator Tillis, please make sure that you're coming from a standpoint where you can show receipts that what he's saying is true, which you can't, because I just showed you the receipts that are opposed to what he's saying. Oh yeah, there's fraud, there's abuse, there's waste, but it's not on Medicare. It's on the insurance companies and the providers who actually accept Medicare. So, food for thought. Thank you for viewing this, and I will see you on the next one. Take care. Peace out, and happy Pride.